My name is Kris Henderson. I'm the Executive Director of Amistad Law Project. Thank you, Chairperson Bass, for your leadership on this issue. And thank you, members of City Council, for the opportunity to provide testimony on why Philadelphians deserve more robust mental health services. Interrupting Criminalization recently released a report called Defund the Police, Invest in Community Care, a guide to non-police mental health crisis response. I'm going to share some information from that report. Since 2015, over 6,000 people have been shot and killed by the police, averaging around 1,000 per year. Of those 6,000, close to 1,500, or almost 1 in 4, 23%, were people who were or were perceived to be experiencing a mental health crisis, with that figure rising to 39% in small or mid-sized metropolitan areas. Of these killings, over 42% were of Black and Latinx people. A person with unmet mental health needs is 16 times more likely to be killed by the police. These alarming figures do not reflect the mass incarceration of people with mental and cognitive disabilities and unmet health needs locked up in jails and prisons, conservatively estimated at bookings numbering 2 million per year, in psychiatric institutions, in emergency rooms, homeless/houseless in the streets, and dying by suicide or overdose every day. People with unmet health needs are more likely to be killed by police, not because they are more violent, but because police should not be responding to those who are experiencing mental health crises. We need better systems. The reason millions of people across the country rose up and demanded cities defund the police is because our communities desperately need resources, and municipalities say again and again that we cannot afford things like violence interrupter programs, job training programs, longer recreation center hours, and healthcare for all. Philadelphia must tax the rich. Philadelphia must reduce the police department budget. We must divert the $6 million currently earmarked for the co-responder program to mental health services around the city. The $7 million allocated for an expansion of the mobile crisis units is a start, but it is not enough. People should be able to call 911 for a loved one experiencing a mental health crisis. We should also be able to access mental health services on a regular basis and be able to maintain that care over time. What if there were drop-in counseling centers across the city? What if there was no wait time between someone to see a therapist and when they can access those services? We keep responding to crises with band-aids.
Kris, we can barely hear you. You're going in and out.
Is it going in and out? Okay. Yeah. Is it better now?
It's a little bit better now.
Okay. We keep responding to crises with band-aids. The murder of Walter Wallace Jr. with an expansion of the co-responder model. An epidemic of gun violence with a police surveillance program called Group Violence Intervention. Philadelphians deserve better. Programs and services across the city have been divested from and defunded for decades. We deserve care and robust support in every neighborhood of the city. We can be a city that prioritizes the mental health of every Philadelphian. Council, divert the co-responder funding and expand mental health resources across the city. And I'm available if anybody has any questions after this.
Thank you so much for your very powerful testimony. And I think you bring up a lot of very valid points. As I mentioned at the beginning of this hearing, we really think about policing and mental health and the intersection of those two very differently today than we did just, a year ago, 5 years ago, 10 years ago. And I think that that's progress, but I think the progress needs to be picked up significantly, and that's why we're all here. And I thank you for being here and for your testimony today and to continue that conversation. If we could have the next speaker testifying, Nikki Grant, Esquire, I believe.
My name is Nikki Grant. I'm the Policy Director at Amistad Law Project. I want to thank the chair of this committee, Chairwoman Bass, for convening today's hearing on this important issue. After the tragic murder of Walter Wallace Jr. by police on October 26, 2020, I also had the privilege of meeting several West and Southwest Philadelphia-based social workers and nurses who saw in Mr. Wallace their own clients and neighbors. We came together to form the Treatment Not Trauma Coalition to fight to ensure that what happened to Mr. Wallace never happens to another Philadelphian.
Yes.
You've heard testimony today about how the Co-Responder Pilot Program, also known as Crisis Intervention Response Teams, or CIRT. You've heard testimony and argument that police co-responders are a step in the right direction or improvement. I want to urge this body to consider that what CIRT actually represents is a further entrenchment of law enforcement in a place that law enforcement has no business being in, for the sake of maintaining the status quo. The implication behind a continuum of care that includes a co-responder model is that there are some people experiencing mental health crises who are violent. We reject this framing. We have seen time and time again what happens when a Black or brown person are in crisis. We are called violent, and our murders by law enforcement are deemed justified. This is why we cannot allow co-responder programs to continue in Philadelphia. Cops are not healers. We believe that the city can and should do better for its residents by not continuing to invest in the police response to mental health crises. What we have been seeing across the country in cities that have both a police and armed police response, such as the STAR program in Denver, is that even though non-police mental health responder program is having excellent results, it is undermined by having the overwhelming number of calls that could be going to a non-police response instead being routed to the co-responder. I'm going to quote from the article. During the initial 6-month period, police received 95,000 calls, 2,500 of which fell into the STAR scope of operation. However, only 743 calls were actually routed to STAR, representing under 3% of all police calls. By comparison, the Cahoots program in Oregon responds to 17% of all calls. We support DBH IDS's proposed expansion of mobile crisis teams and believe that this program will save lives. However, in order for community mobile crisis units to succeed, we must allow them to actually be the first responders responding to all mental health calls. The fact of the matter is that Philadelphia and many cities around the country have systematically defunded mental health services while allowing police budgets to dwindle to obscene amounts. This isn't about who shows up in an emergency. It's also about the persistent underfunding of basic mental health care that people need before there's a crisis. I urge the city to not go forward with police corresponders and instead invest that money in the vital mental health services our communities need. Thank you, and I can be available for questions.
Thank you so much for your testimony. I see that David, Councilman O, are you still there? I know that he had a question, but then he had to withdraw his question because I think he had to leave. Councilwoman Gim has a brief comment. Councilwoman Gim.
Thank you so much. I just want to thank this panel for your tremendous work on leading a real effort to help us think about mental health policing and public safety. This coalition, Madam Chair, has been meeting since, as you know, since Walter Wallace's murder, and you know, they are driven first and foremost by their expertise and their clinical backgrounds, and about you know, a real vision for public safety. And I look forward to continuing to partner with them through this budget cycle. So I just wanted to say and express my thanks, and thank you, Madam Chair.
Thank you, Councilwoman.